Good morning everyone, good morning Mom Easy. I'm Ryaan from Gayak, BSRT-3C, and today we're going to be performing the return demonstration of the metered dose inhaler. So first in the administration of it, before we administer it, we need to explain what it is. An MDI or a metered dose inhaler is a small portable aerosol dispensing device which is hand operated and is powered by propellant called HFA, much like an aerosol spray can. Each activation is given by a certain dose of medication. After that, the patient must squeeze it with proper technique in order for the propellant to insert itself inside the patient's mouth through its lungs. So after that, I'm going to be now identifying the equipments needed for this said RD. First, you'll need your spacer, your pulse oximeter for your patient's vital signs, peak expiratory flow for identifying the activeness of the lungs before and after the meter dose, and our meter dose. We can use an inhaler or a salbutamol inhaler or a Symbicort, and also our watch and our stethoscope. That's it. What are the contraindications of a patient that cannot take MDI administration? So here are a few of the contraindications listed. First, overactive thyroid gland, high blood pressure, excessive body acid, diabetes, low supply of oxygen to the heart, and obstruction of the airway caused by an inhalation of foreign materials. And there's a lot more, but those are the most important ones. After giving the basic information for the MDI administration RD, now let us proceed to the actual performance of the RD. Before, we should always make sure to check the physician's order and the patient's chart. Okay, it's all good. After checking the patient's chart and the physician's order, now we need to gather all the equipment and make sure that the medicine you're giving to your patient is within prior to the expiry date. So all of them are here, and let me check the expiration. Yeah, it's all good. And now after that, we're gonna perform hand washing. Hand washing is the most vital parts of the RD because it avoids any contamination and infection towards the patient and yourself. Yeah, that's it. So after making sure that all the equipments are here, now we're gonna identify the patient, introduce ourselves, and explain the procedure. So, good morning, sir. I'm your RT physician today. My name is Ryaan Gayak, RT-RP. May I know yours?
My name is Gayak.
So today, your physician has finished reviewing your PFT result and has told me to give you an MDI administration. Are you gonna be comfortable with that?
Yeah.
In the MDI administration, basically, we're gonna make you inhale a meter dose before and after getting your vital signs. Are you okay with that?
Yeah.
So after getting the information and explain the patient the procedures, they're gonna be less worried and have less anxiety, and the procedure can be proceeded well and successful. After that, you instruct your patient to either be in a semi-fowler position or in a sitting position. This is because of the fact that these positions gives the diaphragm a better maximal effort and can give us a better result. So make yourself comfortable in the sitting position, sir. Then, after making sure that the patient is in a sitting position, now we assess them of their vital signs. So sir, I'm just going to be taking your vital signs, your respiratory rate, your heart rate, and also your oscillation and your PFER. Are you comfortable with that? So sir, can you put this on your finger? Assessing the patient for their vital sign will help us obtain baseline data and other findings for the patients. So now we're going to be measuring the patient's heart rate, respiratory rate, and the breathing pattern if there's any abnormalities. So sir, I'll start now. Are you okay with that? So inhale, sir. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. exhale. Inhale, exhale. Yes, sir. Breathing is pretty normal. So now we're going to give it time for the patient to breathe properly and count his respiratory rate. After finding out the patient's respiratory rate, you're going to list down in your jot down notebook everything of the patient's vital signs. So first their heart rate, respiratory rate, and abnormal lung sounds. So after that, we're going to be performing PFER test for the patient to identify if there are any improvements before and after the MDI administration. So now I'm just going to instruct the patient how to do the MDI. So sir, basically, you put the mouthpiece right after you inhale maximally. And then you exhale it, you blow it all out. We're going to be doing this 3 times and counting the best accuracy for it. Here you go, sir. Are you ready? Okay. So inhale, inhale, inhale. Put it inside your mouth. Exhale! Okay, that's great. Okay, great result. So after performing it 3 times, you're going to list down the best out of the 3 results of the patient's PFER. And then we're going to perform this PFER after the MDI administration to identify the difference between both. Now, let's go to the MDI administration. So after assessing the patient and reevaluating their papers and such, we're now ready to proceed to the next step. The next step is to make sure to shake and primer your canister. So basically, put it on its mouthpiece, and then shake it, and then spray it 1 time, shake it again, then spray it another time. The main purpose is, for this is to surely give the right dose to the patient, and at the same time, making sure to mix all the medicine inside. After that, after attaching the mouthpiece and the canister, there are options where a patient could use a spacer. But in our RD today, the physician consulted me and told me throughout the paper, the orders, that the patient doesn't need to use a spacer. The spacer devices help the velocity of particles to slower and to avoid static. So now, after this, we'll have our patient hold the MDI a few centimeters away from their mouth and advise them to inhale, to slowly inhale while squeezing the inhaler itself. So sir, now I'm going to advise you to put it closer to your mouth, a few centimeters closer to your mouth, and then inhale slowly. While you're inhaling, squeeze it, and then inhale for 10 seconds and more. Here you go, sir.
Like this?
Closer, sir. Yeah. And then while you're inhaling, squeeze it.
Okay.
So are you ready, sir? Let's go. Inhale, squeeze. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It was a very good inhalation, sir. So, making the patient inhale and slowly exhale creates a good timing for the medication to go throughout his body. So, now, if it was in the order of the physician to give him 2 puffs or 2 doses, we're going to repeat the process. But here, the patient was just ordered to have 1 puff. After this procedure, we're going to reassess our patient again with their vital signs to see any improvements in their lung capacity after the bronchodilator or the MDI administration. So sir, we're going to be checking your heart rate, your lung sounds, and your respiratory rate again, and also your PFR. You found that? Yes sir, let's go like this. Same procedure, inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, sir, your breath sounds pretty good compared to the last vital sign check, and it seems like your breathing actually improved right after the MDI administration. So to finally close the study or the checkup, let's do your PFR test and let's check if it really improved. So sir, same procedure. Inhale and then exhale. Go out to it. So inhale, put it inside your mouth. Exhale. Okay, sir. Wow, it actually improved. So I'll put it down in the note that that MDI administration actually works for you for inhaler salbutamol. So sir, I just want to advise you that every after take of your puffs, you need to drink water, as the water there I have put. You need to rinse your mouth to avoid any oral infection and such. Can you drink water right now, sir? Can you rinse your mouth? Okay, sir. Thank you for the cooperation and such. I'll be documenting your results and then give it to your physician, and your physician is gonna give you the medications you need. Thank you very much, sir, and have a good day. So after thanking the patient for their cooperation, now we should always do the final step in our RD, which is do aftercare. Make sure to clean every single part of your area to make sure that there aren't any contamination and to avoid any infection. Make sure that the sterilized part are on its places and such. After that, make sure to do hand wash. Performing hand wash will keep you safe from any contamination and other infection towards other patients and the safety of the public. So finally, we are the part of documenting the data and proving that the patient is actually capable of having better lungs capacity after the MDI administration. This shows that there's a summarization of the tolerance of treatment and the care and response of the patient to the treatment. So that's it for our RD for the MDI. Thank you, Mom AZ, and thank you, watchers, for understanding the video.